Good evening, everybody. Thank you, Jen, for inviting me to speak about a topic that is not easy. It's my understanding that I need to talk today about emotional healing, emotional recovery after a cancer diagnosis, after a journey that's sometimes for many of you grueling. I don't have slides. I'm going to talk off the cuff, a little bit philosophical, maybe a little bit like a rambling, but I'm hoping that a lot of it resonates, and we'll see how far my voice will let me go. But some of the take-home messages, they always tell us to have at least 3 take-home messages. So let the first one be that everybody is unique. And so there is not one way in which you're going to go through this journey. Everybody has their own way. And what I mean with that is that this journey is different for everybody. I'm trying to use terms that may resonate with you. Once your cancer treatment intensity, if in decreases, if not totally ends, you start to feel differently. You start to feel several things. One of them is you start to feel like you've lost time. The time you went through the treatments that you really wish you could have spent on getting a head start on using your time efficiently, because who knows how much time this cancer will give you moving forwards. You may grieve about who you were, and you're not that person right now, and you may not be that person anymore. You may have changed. And grieving, as you all know, has different stages that everybody runs through in different orders. And sometimes you go back to a previous stage. And so some of these stages of grieving are anger or sadness or denial or negotiation, like this can't be happening to you, or there must be something that can be done about it. There's a whole grieving process that you go through to allow you to realize the new you, is the word that they tend to use. But really you're growing, you're maturing, which we do until we die, every step of our life, even when you're an adult. And as you move through the grieving process and you grow, you will find yourself making different choices. You will find yourself having different priorities in your life. And you may find that your life itself will change, but doesn't have to. Some people say, I'm going to divorce, I'm going to quit my job, I'm going to move to the other side of the globe. But other people, after they go through this process that can be a little hard sometimes, soul searching, they decide, I am just fine where I am, or I may have to make a few little tweaks, but I don't have to totally put my life upside down. But it is all a process. Don't do things hastily, impulsively, just like they say to pregnant women who have just delivered and have this hormonal roller coaster. They say, don't make impulsive decisions. And it's the same for cancer survivors. You have so many physical, hormonal, inflammatory things going through your body that you should allow yourself. I use the word shoot. I'll talk about that in a second too, but you should allow yourself some time to reflect, like, what's really happening here? What do I really want? And if others are involved, what do we really want? On the same path, or are we maybe separating our paths? And that is all unique, but where it leads to in the end, grieving, reflecting, growing, maturing, will allow you to find meaning and purpose. And that is something that, I don't know, is the end product of somewhat of a struggling pathway. Grieving, the end product, the final stage, allows you to find meaning and purpose. And that, for many, is what life is about. Life is not necessarily to be happy. It's not a goal in life to necessarily be rich, which I know many of you know, though it's good to have some money in the bank, but it's not important. Many things are not important except meaning and purpose, having a role, a reason to wake up in the morning and do some good, whatever that means for you in your own unique way. So that's a long-winded answer to say that we're all different. Some of you struggle more than others. Some of you start struggling early. Some of you start that grieving journey later. You're all different, and you're all doing it in your own way. When, maybe second message, when do you need help with that? I usually say, if and when you start thinking about, do I need to talk with somebody? Maybe you should, because there's a reason that it somehow subconsciously popped up in your head. But also, if you find yourself being stuck, maybe preoccupied with some of your thoughts and feelings, almost to the degree that you're paralyzed by it. You can't sleep overnight. You can't function during the day. You're procrastinating. When you feel it starts to interfere with your function at home or at work, then I would say go and talk with somebody. For the most part, it's not a need to be a long-lasting, intensive, let's go back to your childhood type of thing. For the most part, Mother Galena's face expression. Never mind. So just erase that. But it's, for the most part, it's just you need a little push in the back to have somebody neutral who you can talk with, so you don't have to bite your, how do you say that? Bite your tongue when you're with people who you love and you want to spare them, but you can really honestly tell some neutral person your raw feelings and have the other person help you without you being afraid of how you're affecting them. So I think that's my second message. Only you know when the time is right to talk with somebody. Some of you don't need it. Some of you may need it. No need to be embarrassed. I think it's healthy for everybody to have somebody to talk to. But that's my personal bias. It needs to be somebody you click with. And if after a few sessions, give them a chance, it turns out that you just really don't feel like there's a click, it's just like with any other relationship, then find somebody else with whom you do have to click. Because research found that talk therapy, the most effective part of talk therapy is determined by the relationship you have, professional relationship, the connection you have with your therapist. So find somebody who you feel gets you. And that will allow you to maybe go through these stages a little quicker and then have that so-called silver lining, post-traumatic growth. There's many, many terms for it, and they sound fancy. Yes. So Okay. Mhm. So at this point, we went through two messages. One is that everybody heals in their own way, at their own rate. Second message is we talked a little bit about when to see somebody, and it doesn't really matter who, whether it's a social worker or a navigator or a psychologist, somebody who you feel gets you. And then thirdly, maybe let's talk about the word shoot that I used. Because many cancer survivors tend to let me start differently. A cancer diagnosis is very traumatizing for many. It's a very scary thing. And our society is doing a great job, but sometimes maybe a little too great, to tell us that lifestyle has a very big role in you developing cancer. And once you've had cancer, a recurrence of cancer. And they almost pound us over the head with it. And they all make us sometimes feel very guilty. And then we're very susceptible to that. Because once the treatment is done, we are wondering like, okay, I'm not doing anything anymore to help the cancer. So what can I do? Well, the only thing that I can do in my control is lifestyle. And so we're very susceptible and vulnerable to those messages. And so we pound ourselves often over the head. I should be eating healthier. I should be moving more. I should be stressing less. So then we're stressing about the fact that we're stressing. I mean, the list goes on, but I think you get my point. Yes, there is a relationship between lifestyle and cancer development and cancer outcomes, but it has its limits. And it's not 100% responsible for any bad outcomes. There's still so many things in our body, the black box, that we still don't understand. Meaning, I don't think you can say if the cancer comes back that you didn't do enough to prevent that from happening. Meaning, you should, here we go with my shoulds, find your own healthy balance. None of us, not all of us, in particular, I am not destined to be a marathon runner. So some of you may really not like Brussels sprouts. What I'm trying to say is you need to find in your own unique way your happy medium balance in terms of your lifestyle, what fits with who you are and what's doable for who you are. Maybe move the needle a little bit, but you don't have to go to extremes. You still have to honor who you are, if I make sense. Don't whip yourself up with I should, which we do very easily in this society. So I think that would be my third message, is catch yourself when you say these things to yourself, that little voice in your head. Find that nice voice that can counteract. Do you remember those cartoons like the little birdie, Tweety, right? Two birdies talking, one birdie talking in a punitive way and the other one talking in a nice way. Which birdie is going to win? Don't let the punitive birdie that works in on your conscience get too much of an overhand. So I think those will be my three take-home messages. When does healing really end? Just to close it off, my piece of this monologue. when does your emotional healing end? I think honestly, maybe never, because I hope it raises your awareness for your inner workings here and awareness of your own emotional well-being. Meaning, I'm trying to say, I hope it will keep you on your toes and aware of your emotional well-being that deserves just as much attention as your physical well-being until the end of your life. It's very important that you listen to yourself and don't treat, how do they say that? They say treat another the way you wanted to be treated yourself, but you can also do it the other way around. Sometimes many of us are better in treating others well than we do ourselves. So treat yourself the way you treat others. If I'm not massively confusing all of you now. But I hope this makes sense. That I gave you some philosophical thoughts to think about, and maybe Jen, we can open it up for Q&A.